Infection, incisions opening, and wound complications are among the most common issues patients experience after traveling abroad for a facelift procedure. It can absolutely be done well, but when it's not planned properly, patients can find themselves dealing with a bad result. Hi, I'm Sam, and this is Beauty Seek. Today we are exploring a very important beauty tourism question. If you choose to travel for a facelift, what must be in place so you are safe before, during, and especially after the procedure? Dr. Marco, as a surgeon who treats patients in Mexico, what is the difference between a well-planned surgical travel experience and a risky one?
This is a very extensive topic to talk about, especially doctors like me that we only do medical tourism surgeries. You need to be aware that there are patients that they won't follow instructions. There are patients that are lovely and they will follow every single instruction you will tell them, even if that means that they need to stay longer because of a revision, because of a hematoma, because of a seroma, because of something happened. There are very good patients, and we understand that there are patients that they cannot stay longer here and they need to go back. So things can go wrong. The thing you said, that infection, healing problems, wound openings, that can happen everywhere. Of course, if you are in the city you live and your doctor is right 10, 15 minutes away from you, it's easier to seek assistance, right? Or to see what is need to be done. Now, what I've heard a lot from patients, especially from the US and Canada, is that the aftercare sometimes is not the ideal one. So that is something that we put a lot of energy into. But another very important thing is just to assure my patients that if something happens, they can rely on me. What we usually do is my assistant Barbara and me, we always text patients, not that often because we don't want to bother them that often, but at least every week, every other week, we send a text message asking for pictures, asking how the scars are looking, how they feel, how is the numbing, if they resolve everything, how is the healing process, how they feel, the swelling. There's a lot of issues related to the aftercare, right? So what I need is my patient to be comfortable texting me, asking me whatever they want. They have my personal cell phone number and my assistant's number. So they can text me whenever they want, because if something happens, I need to tell them what to do. So if they cannot get assistance back in the US, what I always tell my patients is, you are just one flight away from me and I will take care of it. Now, what I promise my patients is, if I need to do something else, like, I don't know, to drain a hematoma, to drain a seroma, that happened to me last week. A seroma, very strange, is the first one I see. If I need, I don't know, you don't like the result, something happened in the healing process of the neck and it doesn't look good. If I need to do something else, we won't charge you anything. The only thing is you need to come here and you will pay the hospital costs, because the hospital is not mine, and the anesthesiologist fee. Things can happen. Infections can happen here in the US, in Canada, in the UK, in Thailand, whatever. Every time you cut the skin, there is a chance that a bacteria from the skin infect the incisions. Now, some things can go wrong and sometimes patients can get into trouble. We always recommend patients to stay at recovery houses under 24/7 nurse care. Why? Because usually a patient that is getting a facelift is not related to the medical field, usually, and they don't know how to clean themselves and to keep everything as clean as possible. So probably they can get an infection from another source other than the surgery. So we need to be sure that we think about every single possible scenario to get the best result possible. If you ask me, have you ever had infections on plastic surgery? Yes, I had. If you ask me how often it happens, the average risk of an infection on every single procedure is something between 1 to 3%. And we are into that range. That means that we do things the way they need to be done But I mean, you can read, listen, and know someone that tells that going abroad is the worst idea ever. I understand why they say it. And I understand as well why a lot of people come here to get surgery because it's good quality surgery, is a really good aftercare and pre and before care, everything. We try to get the best quality as possible. And well, I'm sure not everybody can pay $300,000 for a facelift. They can get good quality services abroad, not only Mexico, Turkey, or wherever they want to go. Just they need to do the research and need to understand how everything works and follow instructions.
So what I'm hearing is the real difference. It's not the country typically for a safe or unsafe surgery abroad. It's does the patient have a clear plan for care specifically after surgery?
Yes, that is the reason we always advise patients to stay at a recovery house. A lot, maybe it's a little bit more expensive, but they have nurse care. They are providing us twice a day the vital signs, how they're doing, if they are eating or not, if they get everything cleaned up, if they have something different, they take a picture and send it to us. They are taking care of 24/7 hours, 24 hours a day, the time they are at the recovery house, and that is just remember something. Complications can happen in every single patient, in every single country, but the fastest you act upon it, the better results you will have it. Now, if you are staying at a hotel because you don't want to pay the recovery house, and you tell the doctor that 5 days ago you noticed something, that is going to be a problem, and it's going to be a problem, it's going to be probably a bad result, but it's not because of the aftercare or the country. It's because the lack of communication with the patient. And that is something that needs to be addressed before surgery, after surgery. And that is the reason we text patients every single day. How are you doing today? How you feel? Did you get good sleep? How are your vital signs? Although we already know them because of the recovery houses information, we are in constant contact with the patients.
Next, Dr. Marco walks through what happens when patients travel without a real follow up plan. Save this interview so you don't lose it when comparing your travel abroad options for your facelift. I'm Sam with Beauty Seek here with Dr. Marco Marroquin, a plastic surgeon from Guatemala who trained in general surgery and plastic surgery and received academic honors from the Universidad Francisco Marroquin and the University of San Carlos of Guatemala. Welcome, Dr. Marco.
I've seen patients that they come here, they were instructed to stay here for 10 days, and on day number 5 they're like, doctor, I'm already home, sorry, but I needed to come here. They do things like that. And probably 70% nothing bad is going to happen, but the other 30%, there is not so much things I can do other than give them a good advice. But if they don't stay here the amount of time requested, there is a reason we ask for a certain amount of days here, because we need to be sure that everything is okay before you fly back home. There was one patient after a tummy tuck that she left the day after. It was unbelievable. And she communicated with us 2 weeks after saying that everything was okay. But yeah, I'm like, do you think I'm going to do another surgery in that patient? Never in my life. Because it's my reputation, it's her life. At the end, I'm responsible of everything. And no, I don't need those type of patients. And there's a lot of them.
I'm shocked to hear that someone would leave after you. So, how many days do you ask them to stay after surgery in Guatemala?
For example, a patient needs to arrive 2 days before surgery because we need the main thing is we need to prevent a blood clot. In every single plastic surgery, you cannot travel like long travels more than 4 hours 2 days before surgery because the risk of a blood clot on your legs is higher. That is one of the main reasons. I need the patient to get some pre-op labs done, like blood work, and I need a cardiologist to clear the patient for surgery. That is a must. If the blood work is not good enough, I mean, if there is something wrong, and the cardiologist tell me that there is something wrong with the patient, like high blood pressure, and we didn't know about it, I cannot do the surgery, right? But if everything is okay, then we do surgery on day number 3. The patient stay one night at the hospital, so I'm sure that during the night there is no problem, no hematoma, no bleeding, no nothing. We discharge the patient the next day, and the patient needs to stay here 9 more days. The reason is on day number 3, we remove the drains and the hemostatic net stitches. Sometimes we place some stitches to prevent chemosis on the eyelids. We remove it on day number 3 as well. Then on day number 6, we need to remove stitches from the lip lift or eyelid surgery. It depends on what surgery the patient got. And on day number 9, we remove the rest of the stitches, and then the patient can fly back home. And usually they are 80% healed, something like that, 85. They have some bruising, they're swelling, but if someone, they don't know them, probably they can get away without someone notice that she had surgery, right? I'm saying she because most of our patients are female patients, right? So that is the way we do it. 12 days is a must. If a patient can't stay 12 days, I cannot do the surgery because I'm sure they won't find someone to remove stitches back home. And that is going to be a problem for the patient.
Right. That makes so much sense. I mean, why would you leave?
Yeah, nothing at all. It's just we need to be sure that everything is okay before we can release the patient back home.
Beauty seekers, if you know someone planning to travel abroad for a facelift surgery, share this interview with them because they may not be thinking about what happens if they come home with an infection or an incision that starts to open. Dr. Marco, if a patient wants to travel for surgery, what does a safe plan actually include?
I think the most important part of the plan is to find the right doctor. There are plenty of doctors, right? But it is very weird, unbelievable that there are patients that they have been doing research for 4 years and they end up with someone that it wasn't a plastic surgeon or an ENT doctor. That is something that shouldn't happen. So if you're in good hands, it doesn't mean that that is everything you need, but that is one of the most important aspects of getting a safe surgery done. Then you need to decide, for example, the first thing a patient needs to know is I want to stay here. It's not because it's cheaper, but it is one good reason patients coming to Mexico or Thailand or Turkey because it's cheaper than the US. That is true. Cheaper doesn't mean that the service is worse. That is true as well. So if the patient do the research, find a good doctor, they need to plan everything. Where are they staying? If they're going to be by themselves, if they have nurse care, how are they? Even small things like is the Uber system is working well at the country I want to go, or the area where the hospital is located is a safe area. You should stay closer to the hospital just in case something, especially if you're coming by yourself, right? Now, I think it's a good idea if you come with someone else. Someone, I don't know, your husband, your brother, your cousin, someone just to look after you, someone that we can communicate with and let them know how things are going on, how was the surgery, how long it took, how the patient is doing at the recovery area, just to keep the family. Usually, family knows that patients are coming here, just to keep everything calm and they know that everything is on the right way, right? So I think that is a very important thing. And the last thing is follow post op instructions. Like if I tell you, please apply this cream twice a day, do it twice a day. If I give you painkillers and antibiotic medication every 8 hours, do it. The problem, most of the times, the problem with following instructions, especially for medications, sometimes they are like, I don't need a painkiller. My pain threshold is good. It's not just because of the pain. If you get into pain, your blood pressure will increase and the risk of bleeding is higher. Yeah, I know that, but I won't take it. Like, I cannot babysit every single patient. So if the patient follow instructions, everything should be as safe as possible as in everywhere else.
Perfect. In America, depending upon what state you're in, you could be a plastic surgeon who you have very specific training, or you could be a cosmetic surgeon, which is you could have a very different type of education, and the two aren't the same. Does that exist in Mexico?
There are three different schools for cosmetic doctors, not even surgeons. They are not even surgeons. They are doctors that they couldn't get into surgery residence, and of course they couldn't get into plastics. So what they do is those schools, they have online training for, I don't know, 6 months or 1 year. Then, as I've heard, they need to get, I don't know, 5 patients, and the doctor is going to get there and show them how to do it. And after 1 year, you're good to go. So it is a very, very big problem in Mexico. And the worst thing is that I think that board certified plastic surgeons, we are something like 2,300, something like that. And I think that cosmetic doctors are over 20,000. So when a patient is trying to come to Mexico, they need to be very careful that you're getting treated by a board certified plastic surgeon. There are some ENT doctors that they do very nice jobs on facelifts, but at least they are ENT doctors, right? They are not some general doctor that they saw how they did a blepharoplasty and now I'm going to do it to you. So patients need to be very careful. And I think it's all over Latin America, even in the US. Those doctors, they are trained, they are supposed to be trained to do injectables, Botox, hyaluronic acid, some laser treatments, like a lot of non-invasive treatments. But at the end, because they know they can charge more money doing surgeries, somehow they get into that. One of the very important things you need to know is, if you want to know if that doctor is a board certified plastic surgeon, just ask the doctor to get your surgery done at a big certified hospital. They are not allowed to get into that hospital. So that is one of your secure spots that you can say, well, this doctor can do the surgery at this hospital. And so I know it's board certified. Then you can check on the CMCPER page, that is the one that certifies all plastic surgeons in Mexico. And if your doctor is not there, well, that doesn't mean that he's not a plastic surgeon. That means that he is not board certified. So he might be a plastic surgeon, but somehow he hasn't been certified. There is some of them, not that much, but there are some of them. But usually we are all there. You need to do in your research so you don't end up with someone that wasn't even a doctor, right? So you need to be careful on your research. I see that patients rely on a lot, for example, real self, and those you can pay for some things on those platforms to be the first one on the list. And a lot of things move by money. So there are certain things that you can be sure of, and there are certain things that you need to do more research.
I love that. Thank you for sharing that, because I didn't know when I got my surgery. I had no clue, honestly, until just a few months ago that, there were different levels of surgeons and or doctors who aren't necessarily plastic surgeons. So it was shocking to me.
Yeah, as I told you, it's a really big health problem here.
I can imagine. I can imagine. It is here as well, especially in the injection community as well. That you don't necessarily even have to be an RN, a registered nurse, to be giving injections, at least in Minnesota.
I have a brother that lives in Houston, and that's the first time I heard the term injectors. And I'm like, oh, so, I mean, it's a plastic surgeon. No, it's someone that used to work with him, and apparently the plastic surgeon gives them the Botox under the name, and they learn how to inject the face, and they do it now. And I'm like, okay. So there is a lot of things involved in the cosmetic and beauty industry.
And that's part of the reason why I launched Beauty Seek, just so we beauty seekers can start to be more informed, because there's so much misinformation and there's so much information. So we're hoping that this will be a destination where professionals like you, who are mission driven to educate, can share their knowledge, and beauty seekers will have a safe place to come and learn and be able to feel safe to ask the right questions.
You know how everything goes now with social media and stuff, right? So years ago, I got a company that they were like asking me every single day, you need to do videos, you need to do it. And I'm not doing videos. I won't do it. I don't ask me to do that. I'm not the guy for that. Because at that time, there was a lot of dancing and still not doing the right things to educate people, right? But I said, okay, let's do a video. I find I found myself like I really like to tell and sometimes tell the ugly truth about things, but just to educate people and just in my knowledge and my experience, just to let them know how things work and how things can work out and how is this about. And I really enjoy doing my videos. And somehow I have some fans that they like the way I communicate things, but it's just because I like to educate the people to know exactly what they're getting into.
Thank you. Thank you for being committed to education. Thank you. So we've come back to our big question. If you choose to travel for a facelift, what must be in place so that a patient is safe before, during, and especially after the procedure?
I think we can point to things. Real and board certified doctor, good recovery place to stay after surgery, open channel to communicate with your doctor, at least his assistants, but preferably the doctor. And you need to talk to your doctor. What is the revision policy? What is going to be charged in case something happens? And what is going to happen in case of emergency? This is a very good topic. And I think we don't have that much time for that. But, you know, there must be, and it was in the past, and it's been hard for me to find out the best option for a patient going abroad is to find an insurance for medical travel. It costs something around $400 in case they don't have medical insurance. If something happens here, that is very rare, but it can happen. So that insurance thing, it is a very, very important thing about medical tourism patients. And there's a lack of information about it.
I've heard of it now that you say that again, but it would not even be on my checklist if I were to travel for an aesthetic procedure. Thank you.
For example, in Mexico, if you have a private medical insurance, most of the times they don't cover any aesthetic related things. But now, if you have a complication, for example, a pulmonary embolism, some of them they cover the complication because you have a pulmonary embolism. It's another topic that it is because of a aesthetic surgery. And there are some of them that they won't cover it because it is as a result of I don't know, liposuction or something. So there is a lot of uh, you can say potholes. Like there is a lot of unknown things about this, and I think that if you're traveling abroad, even if it's to Mexico, like across the border, you should be able to get in touch and get a good insurance service just in case. You know, in 19 years, I have two patients in the ICU unit. One was a facelift patient that has an allergic reaction to a medication, and the second one was a patient, and it was recently. It was a patient with uncontrolled high blood pressure during the surgery. So, but you know, in 19 years, two patients that require ICU care is very low rate, but things can happen. That the first patient was the one I heard about and learned about Kaiser Permanente because they flew him out of here. And 2 days after he sent me a picture, like, thank you for my face. And I was like, thank you for aging 10 years in 2 days for me. It is very stressful. It's not just the patient. I understand patients are scared and worry about what if something happens. Is the same for us. I'm responsible for my patient. And when something doesn't go as well as it was supposed to, we get stressed as well, and we try to fix everything as soon as possible and the best way as possible.
I feel it. I feel that you care for your patients. Thank you so much. Beauty seekers, if you are traveling abroad for an aesthetic procedure, clearly determine your before, during, and after safety plan, including, as Dr. Marco says, medical travel insurance. Dr. Marco, thank you for helping beauty tourists like me to think through the full details of traveling for an aesthetic procedure and the critical at-home recovery period after the procedure. We appreciate you.
You are welcome. This has been fun, and as I told you, I just like to educate people, and they just get them to know that it is not as complicated as is made think they may think that it is complicated. It is not, and we try, believe me, to do our best to get everything as safe as possible, as safe as back home, because every single patient they compare everything to back home. So we try to match everything just with better aftercare. We try to do a lot of things for aftercare for our patients.
Yeah, I feel it. And I've heard that too. The more I've interviewed some patients, gone abroad and their experience has been superior to what we sometimes receive here in the US. For example, the creams you talk about, the hyperbaric chambers, those are all amazing things that I never hear about with procedures here.
What happened is that now what I'm seeing is a lot of the main plastic surgeons that are on social media, they have their own hyperbaric chambers in their own clinics. What I see is that they have their own space and they have everything in there. There are really, really good surgeons over there. We always want to train with them. But medical tourism exists for a reason, and we are trying to get this done the best way possible.
Exactly. Thank you very much. Appreciate the diligence and the focus on safety and welcoming patients from abroad.
We'll try to do our best. So you're welcome. And sorry for my accent because it's not my main language, but I try to do my best as well.
You did great. Oh my God.